Thanks for joining the webinar. I think it'll take about a half an hour, 45 minutes. We'll obviously leave time for some questions. But what we're talking about is over-the-counter hearing aids, okay? And so I'll say that we've had a number of patients, people in the general public that have asked, our practice, me specifically, about what they are, what we should know about them, how does it affect, clinics, audiologists, places that sell hearing aids outside of, audiology practices, and sort of what are the differences between typical prescription hearing aids and over-the-counter hearing aids. So this is my first time addressing this specific topic, so it's exciting. So we're going to kind of dive right into it. Here are some of the questions that have been posed to me and to our practice. First of all, what are they? Why are hearing aids being offered over the counter? Who's a good candidate for over-the-counter hearing aids? What concerns exist regarding over-the-counter hearing aids? Can I return these over-the-counter hearing aids? And what are the laws, in place currently? Are OTC hearing aids programmable? And then finally, where can I get help if I have questions or problems? Over-the-counter hearing aids, again, or OTCs, are devices that make sounds louder. They are only approved for adults age 18 and older, so no children. They are indicated for individuals with self-perceived mild to moderate hearing loss. It's sort of the first question. How do you know if you have a mild to moderate hearing loss if your hearing hasn't been tested, right? You're not required to get a hearing test. So this is self-perceived. They're available in stores. I haven't actually been to my pharmacy, but CVS, Walgreens, local stores like that, Best Buy, electronic stores, or of course online. The consumer is responsible for setting it up, including the fitting and tuning of the sound. So it's basically, you're just taking that off the shelf, taking it home, opening the box and doing this yourself. A hearing exam or a prescription from a physician or anything hearing health related is not required from a professional to purchase these devices. Okay, so why are they being offered? So this actually goes back to 2017. The FDA Reauthorization Act directed the FDA to establish some regulations, some guidelines of having this new classification of OTC hearing aids, basically in the response to consumers offering something that's A, more affordable, B, more accessible, and actually is just getting more awareness of hearing loss and hearing aids out there. Now, they're in the process of sort of finalizing these guidelines, but basically the rules that are currently put in place are, there's a regulation as far as how loud these devices can be, what kind of labeling has to be on the side, on the inside and outside of the packaging in the box, and the requirements are related to the sale of these devices, right? Now, how well is this enforced? That's yet to be determined as well. But getting back to the mild to moderate hearing loss, so for instance, if a patient has, thresholds that are in the severe range, these devices will not have the ability to provide amplification necessary to fit that degree of hearing loss. So that's the why behind it. So who's a good candidate for OTC hearing aids? They're approved, as I said before, only for adults age 18 years of age and older who have, again, that self-perceived mild to moderate hearing loss. Any academy, the American Academy of Audiology, the American Doctors of Audiology, the American Speech, Language, and Hearing Association, the American Tinnitus Association, they all advise and recommend that patients first get a hearing test from an audiologist to find out what is my hearing loss. Some of the devices are kind of doing sort of their own hearing test, so without seeing an audiologist, but things come in a way of like, well, what if that patient has earwax? What if they don't have the device in their ear properly to properly test their hearing? So there's just a lot of factors there that come into play. So again, advised to get a hearing test first before considering getting these hearing aids. Here's a nice snapshot that I like that really, I'm going to spend a little bit of time on that shows you OTC hearing aids are self-fit. The average price, the cheapest, the least expensive I've seen is a couple of $100. The most expensive I've seen is about $2,800 for a pair. It says here under 1,000, but I've seen some that are well over that price. They're only for, again, ages 18 and older with a self-perceived mild, moderate hearing loss, right? It's one size fits most. So another question is, well, what if the dome or the tip doesn't fit their ear well? Many of them, are they going to have multiple size tips? As an example, like Apple AirPods, initially the first ones didn't have any type of dome or tip. Now the newer ones at least have like 3 different sizes. which may fit your ear, but may not. There's actually currently no requirement as from the FDA as far as return policy. So be well aware. Now, like a place like Best Buy, you would assume they're going to have a return policy there. CVS, Walgreens, like a pharmacy, you want to just know, hey, what is the return policy if I don't like these devices, right? Or again, online. There is no sort of verification. Verification is performing a test. It's best practice procedures where we put a probe microphone. We do this in our office. We put a probe microphone in the ear. We measure the patient's ability to hear with the hearing aids on and verify that we're hitting targets to their prescription hearing loss. So that is not possible with OTC hearing aids. And you're also selecting them yourselves, right? Some of these OTCs are in the ear. Some of these OTCs are over the ear. That's like the first difference. Some of them use an app, some of them don't, right? So there's just a lot of options out there right now, but those options are basically determined, by the consumer themselves. What concerns exist regarding OTC hearing aids? Now, there could be a long list here. I'm just trying to keep it simple. What is not included are professional services. So, if you have a set of these devices and you don't like how they sound, something doesn't seem to be connecting right, it doesn't fit the ear right, it's not comfortable, you're getting feedback, you're not going to go back to the pharmacy. You're not going to go to the pharmacist and say, can you help me with these? And I really, as of right now, the Geek Squad is not going to help you with these products, right, at Best Buy, right? So that's where professional services come into play, right? It's like an audiologist. So the question is like, well, who's going to counsel these patients on, first of all, appropriate care, appropriate fit, style, expectations, benefits, risks, all those types of things. So, we're seeing this in our clinic as perhaps this new arm of service to help patients like this. I mean, we see patients regularly that have hearing aids that are, not performing well, not doing what they expected. They got them from somewhere else. They got them from the VA, whatever it might be. And we're doing that, but not to the level that maybe we might start doing, right? And those services, there's probably going to be a fee for those services. Coming in and using our expertise to help the patient, so they should expect that coming in, right, to get them to a better place. But the other part about it is, we can't program these devices, right? This is all self-fit. So understanding that as well. So there are obviously some concerns there. Can I return OTC hearing aids? As I mentioned before, they do not require anything to be returned, but they do state that the packaging needs to include return policy on the device. So just make sure that you see that, you read that. I really don't think this would be a problem if you had to return them. Just know what the time period is. And is there any sort of like exception to the rule? Like if you broke it, you might not be able to return them. If they dropped it or if it, things like that. So just kind of be aware of those kinds of things if you're considering them. Are they programmable? Okay, great question. The OTC hearing aids are considered customizable, right? So not necessarily programmable, meaning that they have to have the ability to adjust the volume, and you have to have the ability to kind of change pitch, bass, treble, right? Those types of things. If on the device, if the packaging, if it's labeled self-fitting, then what you should expect is that you would have some sort of app or accessory that would create some type of customized program based on your responses. Okay. Is it programmable? I mean, not to the extent that it's not like prescription programmable, but it will have some adjustments. I found this nice little slide from the American Academy of Audiology as far as customization. So we talk about customization of these OTC hearing aids. How specific? I don't know. Right. So that's something worth thinking about. And then we drop down to the next level. The next tier here is that you should expect some degree, if it says self-fitting, to have a button, a push button, maybe a toggle switch that will allow you to change some things from the start of either like pitch or volume. Okay. Or more likely having some sort of app or remote control that will allow you to make some adjustments on the app of that particular device. Still, again, another area that we're also seeing is that some of them will have like preset programs. Let's say they're going to have 3 preset programs, and then they'll ask you, do you like A, B, or C? And you're going to listen and say, well, I liked B over A, right? And then And then it's going to kind of set that as the setting for those devices. So kind of customized to the patient, but there's just a lot of like gray area there. And then again, getting over to the right one that's like self-fitting, perhaps there's going to be some type of like online hearing test or a hearing test conducted within the app that would then sort of customize the devices to the hearing in that sense. Kind of understanding. So there's some customization there. It's not quite the same as like running a hearing test and, fitting it to prescription and then measuring that prescription, on like something called Real Ear. So where can I get help or if I have questions? So here's the other thing. So manufacturers of these devices are not required to provide customer service for these devices over the phone. So don't expect to have a 1-800 number in that box. You're going to be able to call and say, hey, I'm having an issue. Can you help me out? Right? There's not like that support staff there to do that. Will there be maybe some YouTube videos of people? Maybe. As a comparison, traditional hearing aids are required to have access to email, a phone number, besides what we do, besides what the professional does, access to be able to call the company directly or email them and state your issues and, basically have some sort of representation from the company itself. In addition to the information from the manufacturer, well, yeah, so we're going to be involved in some shape or form as well. That's something that we have yet to have a patient or a consumer come in with OTC hearing aids yet, but, I think that time will come. And the question is what will we be able to do and what we won't be able to do and what that looks like. So that'll be interesting as well. Yeah. I mean, look, it's going to be really hard for us if we see someone and they haven't had a hearing test. We're going to be strongly recommending they should get a hearing evaluation so that we know what is your hearing loss. Is it conductive or sensory neural? Is it hot? What is the configuration? Are these appropriate for you? Saying that should really be done. So that's that. So those are the questions that I had.